Sinusitis is a disease process that's caused by swelling or inflammation in the nasal and sinus cavities. This leads to obstruction of normal mucus flow, and that mucus then serves as a petri dish for the growth of infection. Patients with sinusitis can really feel miserable. They can have the typical symptoms of facial pain, headache, cough, and fatigue. It can also trigger other events such as nausea or even migraines. It affects their quality of life more than congestive heart failure or back pain. Sinusitis is most commonly caused by an upper respiratory tract infection such as a cold or flu. However, other conditions such as allergy, asthma, or even smoking can contribute to an environment that encourages these infections.
Let's hear about one patient's experience.
About 10 years ago, I started waking up every morning with a stuffy head, of course, typically on the right-hand side, and easily manageable by taking a hot shower and blowing my nose a couple times. But then about 2 years ago, I started getting the sinus headaches once a month that basically put me bedridden for an entire day, if not more. The right side of my face gets all puffy and it feels like my head's about to explode. I've had to miss work because of it. I've been on vacations and ruined vacations because I couldn't go skiing with my friends, go kayaking. It's just a miserable experience. When I get one of my horrible sinus attacks, I've tried every painkiller I can. I've stuck my head in a bucket of ice water hoping it helps. I've even gone to the local playground and hung upside down the monkey bars thinking that it would drain my sinuses, but absolutely nothing works.
Drugs are usually the first course of action.
The most common treatment for sinusitis is medications, and this includes antibiotics and steroids. And although they're very effective in a one-time acute basis, with repeated use, they have significant health risks and do not adequately solve the problem for the patient.
A gentle new treatment for sinusitis has now been developed that is performed in your doctor's office and is designed to open your sinuses without surgery or regular use of drugs.
The Vent-Os system is a tiny device about the size of a grain of rice. It's inserted in the sinus passage. There, using osmosis, it absorbs fluid from the sinuses, gently expanding and opening the sinus passage. After about an hour, it is removed and the patient can leave the office immediately.
Patient Andrea Layton elected to undergo the Vent-Os procedure.
I just had the device inserted into my sinus and I'm in the waiting room while I wait for it to expand. And it actually just feels a little weird, a little bit of pressure. It's not painful. And the procedure as well as the expansion process is a lot easier than I thought it would be.
Clinical studies have shown that the Vent-Os procedure results in open sinus passageways in the vast majority of patients, even a year out. And in my own practice, my patients have told me that the procedure was easy, simple, and comfortable and resulted in real improvement in their symptoms and quality of life.
Andrea's outcome was positive and her future looks clear.
Now that I've had the procedure, I'm looking forward to not having frequent sinus attacks where I'm stuck on the sofa for 24 hours and my friends are out doing something fun.
For more information on the Vent-Os procedure, please visit sinustreatmentinfo.com.